So we're going to show how a complete physical examination is done. I prefer to start at the head and work my way back so I don't miss anything. We always look at the eyes, and for discharge, then we use an ophthalmoscope to actually look back at the retina. Not all dogs like bright lights shined in their eyes. Good boy. Good, okay, good boy, good boy. We look at the teeth, we look for tartar, for gingivitis. We look to see if there are any cracks in any of the teeth that we can observe. And Pete has good teeth. He's 7 years old. He has a little bit of tartar on those teeth way in the back. But that's pretty consistent with his age. That's not anything to worry about. We look down the ears to make sure that there's no discharge, no wax, no odor. Good boy. Stand up. Pete up. Eat up. Eat up. Oh, good boy. Now, Pete has just been in the process of blowing coat, which is all this little fuzz. You can see that here he looks nice and sleek. Here he still has all this little fuzz coming out, and that is his undercoat. Pete is part husky and part lab, and this is the undercoat that he is shedding. I'm feeling for lymph nodes in the neck, lymph nodes in the armpit, and here by the shoulder. We feel down both legs. We feel in the groin for lymph nodes, and we feel down the back legs for lymph nodes to make sure that nothing is swollen. We palpate down the back and make sure that there's nothing painful there. Also, at the same time, we're feeling for any lumps and bumps that should not be there. We go the other way. Now we are on the abdomen, on the rib cage, again feeling for lumps and bumps. We feel the abdomen. We like a nice soft abdomen where there's no tensing, there's no obvious pain anywhere. We're feeling for swelling. We can feel the liver in a normal dog, but it should not be large. We can feel the spleen in a normal dog, but it should not be large. We can feel all the intestines, and sometimes we can feel the kidneys if the dog is real thin. Pete's not that thin. Now, if this were an intact male, we do want to feel the testicles, make sure the testicles and the scrotal sac feel normal, that there aren't any lumps there. Pete has bad hips. In a dog with bad hips, we really don't want to pull the legs back, but I do manipulate the knees to make sure that there's no pain there. We don't feel any arthritis, and that's good. Now we're going to listen to his heart and lungs. Jen is holding his mouth so he doesn't pant, so I can hear his heart.
I don't like it.
Good boy, you can let it Jen. You did a good job. Everything's fine. His heart sounds fine. His heart rate is a little bit accelerated because he's excited. It's about 80 beats per minute, and it should be probably about 60.